Stem cell therapy, also known as regenerative medicine, is a biotechnology that promotes the repair response of deceased, dysfunctional, or injured tissue using stem cells or their derivatives. It is the next chapter in organ transplantation and uses cells instead of donor organs, which are limited in supply.
Stem cells offer great promise for new medical treatments. Stem cells are the body's raw materials, cells from which all other cells' specialized functions are generated. Under the right conditions in the body or a laboratory, stem cells divide to form more cells called daughter cells. These daughter cells become either new stem cells or specialized cells with a more specific function, such as blood cells, brain cells, heart, muscle cells, or bone cells. No other cell in the body has the natural ability to generate new cell types.
In stem cell transplants, stem cells replace cells damaged by chemotherapy or disease or serve as a way for the donor's immune system to fight some types of cancer and blood-related diseases such as leukemia. These transplants use adult stem cells or umbilical cord blood. Patients with leukemia sometimes benefit from receiving a stem cell transplant or bone marrow transplant. This procedure replenishes the blood stem cells in the bone marrow so they can go on to produce healthy new blood cells.
For some, stem cell transplants can cure leukemia. However, the cancer can come back. While 80 to 90% of adults with acute lymphocytic leukemia will have complete remission at some point during the treatment. Half will experience a relapse. Patients with leukemia sometimes benefit from receiving a stem cell transplant or bone marrow transplant. This procedure replenishes the blood stem cells in the bone marrow so they can go on to produce healthy new blood cells.
Stem cells are a type of biotechnology. Biotechnology is technology that utilizes biological systems, living organisms, or parts of this to develop or create different products. Brewing and baking bread are examples of processes that fall within the concept of biotechnology. Use of yeast equals living organisms to produce the desired product.
Adult stem cells have been found in most parts of the body, including the brain, bone marrow, blood vessels, skin, teeth, and the heart. There are typically a small number of stem cells in each tissue. The process of a stem cell transplant is done by removing stem cells from the blood, which is done through an IV line. An IV is placed in a large vein in the donor's arm, and the IV tubing is attached to a machine that separates and collects the stem cells from the blood. After the stem cells are removed, the blood is returned to the donor. The process takes several hours and may need to be repeated once a day for a few days to collect enough stem cells for a transplant.
If you've been affected by leukemia and get stem cell transplant, after the procedure, it may seem all went well, but you would have to be in the hospital monitored for around 6 to 12 weeks, making sure that the stem cells are working and nothing fatal has gone wrong. It may also take around 6 to 12 months or even more for your body to regenerate all the cells to be at the normal level. Some side effects of stem cell therapy are low blood cell count, could cause infection towards the directed treatment spot, could cause internal bleeding, could cause anemia, a problem of not having enough healthy red blood cells or hemoglobin to carry oxygen to the body's tissue, and it could affect your digestive system.
Embryonic stem cells are an example. ESCs are derived from the inner cell mass of pre-implantation embryos. Another example is included in pluripotent stem cells derived from the epiblast layer of implanted embryos from the umbilical cord.